Hi, my name's Emma. I joined this project with WARGI. It's about why don't men access mental health in rural areas. I suppose my interest revolves around living in a rural area, and I've worked in a predominantly male kind of orientated job for a long time in the outdoors, so have met a lot of men who've struggled with their mental health. When I began reading for my dissertation, I was shocked to find that suicide remains the leading cause of death for men under 50 in the UK, and that they're 3 times more likely than women to die by suicide, highlighting a stark and persistent gender gap in the mental health outcomes. And what's especially concerning is that around 60% of men who died by suicide had accessed some form of help in the previous year. They're also less likely to seek support early, often delaying help until they're in crisis. And then when they do engage, many men don't complete their sessions. Around a third will disengage from NHS talking therapies before finishing their sessions. So I think statistics point to deep issues with how services are designed and accessed and experienced by men, and they underlie the urgent need for more tailored and proactive, meaningful forms of support. We put our questionnaire on SciToolkit, and it had, I suppose, 2 sections. So one section was based around questions, demographic questions, age, because we had to exclude anyone that was under 18, and also exclude anyone that wasn't living in a rural area for longer than a year. Included in the questionnaire were measures, so the self-stigma scale of help seeking, which is a 5-point Likert scale. And then we also had a sliding scale of masculinity, so it was self-selecting, so you would choose 1 up to 7 depending on how masculine you felt you were. And also we put 3 lots of different comments in so that people could comment, and some of those sections had more comments than others. We had 109 responses from our questionnaire that was on SciToolkit. From the 109 responses, we excluded some due to age and also due to not identifying as male, and there was quite a few that were incomplete, so we deleted those, and we were left with 71 usable responses. A lot of those, 80% of those, were from people who said they were living in Wales, and also I think there was 11% were from England, and then there was 1% that was identified as living in Scotland, and 1 from Ireland. And you can see the demographics on the slide. So the oldest age that answered was 75. It's a good range of ages, with the largest age groups were 18 to 24. There was 25% of them, and 45 to 54, 25% of them. And more than 90% identified as white, 85% as heterosexual, and then there's some data there on how people were living, who they were living with, and whether they were in a partnership, and then also what job they identified or what work they identified as doing. And there was, the largest group was 15% that worked in local government and public services, 12.5% who worked in sports and recreation, and 12% who answered worked in education and research. So here we can see some of the key quantitative findings around mental health difficulties, help seeking and masculine identity in this rural male sample. Firstly, 66% of participants reported experiencing mental health difficulties, and that's 2/3 of the sample, showing that poor mental health was an issue in this group. Despite this, there was only half of those participants, or 50%, had accessed professional support. And of those who had, 40% of them chose not to say whether they found it useful or not. And this could reflect uncertainty around the help they found, or disappointment with that help, or perhaps stigma, or possibly discomfort with disclosing that professional help wasn't very useful for them. And also 40% of the participants agreed with the statement that their mental health difficulties are bad enough to seek help. And that could mean that the remaining 60% either disagreed or weren't sure, or were unsure, suggesting that many of the men might not recognise the severity of their struggles, or they might feel that they shouldn't seek help even when they are struggling. This links closely with the self-stigma of seeking help results, and the average score there was nearly 3, which falls into the moderate self-stigma range, and could tell us that many participants felt some degree of shame or embarrassment around the idea of seeking help. There was also widespread scores from 1 up to 5, indicating that while some felt little self-stigma, others experienced high levels. And finally, also looking at masculinity and identity, most of the participants scored moderate to high on traditional masculine traits, and these would be about feeling strong and stoic and self-reliant. And these traits are often culturally reinforced in rural areas and can discourage men from expressing their vulnerability or reaching out for support and help. And altogether, perhaps these findings suggest that while rural men do experience significant mental health challenges, traditional masculine norms and self-stigma are likely to be barriers to them seeking help. So this results slide focuses on 2 key qualitative themes that emerge: how men perceive others' barriers to help seeking and the practical obstacles they face in rural settings. So firstly, many participants framed mental health stigma as something that affects other men, and barriers like embarrassment and fear of judgment were often talked about, but in a somewhat, I suppose, distanced way. So when they were asked if they themselves were embarrassed to ask for help, there was 49 out of 55 respondents disagreed with that statement. So only a small minority admitted to feeling that. But when they were asked whether other men are too embarrassed to seek help, the pattern reverses, so that they see so 45 out of 69 agreed with that statement. And this suggests that while stigma is clearly recognised, it's externalised, seen as a community-wide issue, but not necessarily something individuals admit affects them personally. So this sort of othering of the stigma could reflect a reluctance to show vulnerability or admit their own internal struggles. Now, in terms of practical barriers, participants pointed to several familiar challenges that are common in rural areas, like long waiting lists and high costs and poor transport links. These issues can make it difficult to access support even when men want to find help. This is a key part of kind of the difficulties of living in a rural area. There's also a sense that mental health services often don't align with rural realities, as one participant put it. They don't understand rural life, and this reflects a broader concern that support is perhaps not culturally tailored, lacking in maybe relevance, and that men might not trust that it's accessible for them. And together, these findings could show that both social and structural barriers play a role in limiting the help seeking among this population, and maybe it's subtle, in subtle and reinforcing ways. When asked about the help they'd received in the questionnaire, just over half of participants had experienced mental health struggles. Around 50% of them said they had accessed some form of support, and the most common source was the GP, used by 29%. However, this support was often described negatively, and some participants summed up that they were just given pills, and this reflects a broader dissatisfaction with the medicalised responses that were in the questionnaire. And counsellors who were accessed by 23% of men, with fewer turning to therapists and some to support groups, but overall there seemed to be a sense of frustration as a theme. One participant speaking described their journey as a Kafkaesque nightmare of forms, referrals, wait lists and cancelled appointments that seemed more designed to get rid of you than help you. And cost was also seen as a barrier. Several respondents mentioned the high price of private therapy. As one put it simply, it's been costly. When asked when they last received support, the responses were mixed, and a small number had accessed help recently, 10% within the past week, 4% in the past month, and 7% in the past year. Others hadn't received help in years. 17% said 2 to 5 years ago, and 9% said 6 to 10 years ago, and 12% hadn't accessed help for over a decade. But notably, 39% of respondents preferred not to answer that question, and I wonder if this is about how useful the support was. And responses were divided on that, with 19% finding it useful, 25% said it was moderately useful, and 15% said it wasn't useful at all. And again, 37% preferred not to answer that question, perhaps reflecting discomfort or dissatisfaction. And looking ahead, the intentions to seek help were uncertain. 14 said they planned to, 26 said they wouldn't, and 29 respondents weren't sure. This uncertainty may reflect past negative experience or persistent structural, cultural barriers, or both. The words I've put up on the screen here come from the qualitative comments collected around mental health support in rural areas, where many men describe the cultural expectations and internal pressures that shape their experiences. As one participant reflected, as I've been told to man up all my life, and others described how men typically want to present themselves as strong and unwaverable. These ideas illustrate how masculinity is often tied into stoicism and self-reliance, and support seeking was frequently described as a taboo topic, surrounded by some dismissive attitudes like being a real man and don't cry, stop moaning, or one participant said snowflake for showing vulnerability. These aren't just outside messages, they've been absorbed and internalized. One older participant expressed, we need to be supporting our families and not collapsing, being part of the problem. And this comment, I feel, captures how help seeking can feel like failing, as when you're a provider for your family, or that's the view you have of yourself. Another summed up the contradiction. Despite almost everyone knowing someone who's taken their own life in their community, they still hold this belief that they don't need help, or if they do, perhaps they don't know how to take that first step towards finding help. Life in rural areas can present unique challenges that significantly impact mental health, particularly for those in farming and the related occupations. It's not just a job, it's a way of life, often marked by long hours, financial uncertainty and high pressure, and rural poverty can add another layer of stress. For many, this lifestyle is also can be isolating, and farmers in our survey said they could go for days without a meaningful interaction. Infrastructure is another issue. In some areas in Wales it can take over an hour to travel just 15 minutes, and this was explained by one of the participants in the study. So some practical ideas for improving mental health support for rural men could include the need for effective health training for medical professionals, as sometimes men can misconstrue their mental health needs with physical symptoms and perhaps go to the doctors, and so therefore perhaps GPs and frontline staff could miss signs and symptoms of it being a mental health issue rather than a somatic pain. So also the call for more flexibility in service hours for rural men working long or irregular hours. Having access to appointments at weekends or evenings could make a real difference. Another idea was introduction of more male specific helplines targeted at men, so also that mental health access should and could be everywhere and more obvious in a sort of psychoeducational way, and that there's anonymous tailored points of contact for men who might not otherwise feel comfortable being able to reach out. And overall, participants were asking for a system that's both better equipped and more accessible, and one that understands and responds to the realities of rural life. So some participants emphasised the need to think beyond a traditional clinical setting and have more alternative, accessible environments such as community halls and peer spaces where men might feel more at ease, and that there's strong support for peer-led and community-based models which can feel less formal, more relatable and better suited to rural areas, and collaborating with grassroots groups such as one group that's called the Lads Cafe on Llyn Peninsula. And the participants also suggested training local facilitators to help begin opportunistic conversations more informally, but meaningful check-ins that can happen naturally in community settings. And some also call for men-only spaces where help seeking could be normalised and the stigma around asking for help was reduced. So in terms of implications for counselling and care providers, then this study could show that the importance of tailoring mental health interventions to rural male populations, and that might include outreach and more peer-led initiatives like the one earlier from the Llyn Peninsula, and more anonymous or online options, and also training for local practitioners that takes rural masculinity into account and using a strengths-based approach. And looking forward for rural men isn't just about increasing service availability, it's about reshaping the narratives around masculinity, community, and what it means for men to seek help. Thanks for listening, and there's some references on the next slide.